Yeah, so as Pedro says, my name is Josie. I feel incredibly privileged to be able to speak to you as a current HLA scholar. It's been an ambition of mine for a number of years, and I'm just going to give you a little whistle-stop tour of my project this year. And I'm conscious, just following on from Hale's absolutely fantastic project, which is just mind-blowing what he's achieved through his leadership skills in the HLA, that I'm also talking about a project that I started before I came to HLA, and how the HLA has really just allowed me to take the next really crucial step. But I just know so many other people, and I had a number of other ideas about projects that I'm absolutely sure the HLA would have empowered me and catalysed me to move forward in taking those. So please don't feel that if you haven't got a pre-formed project, that you can't make it success of being a scholar. So my project, as you can probably guess from the infographics and so forth on my front page, is looking at period parity or period poverty. And there's been a lot of focus on this, quite rightly, I think, in the UK community at large, but far less of a focus in terms of NHS staff and their experiences, particularly the nuances that their access to period products might actually incorporate, given the kind of very unusual work practices that we have, which was really brought to light, I think, and brought to the fore during the COVID-19 pandemic. So let's see if I can move this one. There we go. So this just gives a really brief overview of what I did before I came to HLA. So I started my project in 2018. There was very little out there at the time. I couldn't encounter anyone who was doing this kind of project when I was standing out on social media. But I'm really, really pleased to see that things have moved on over the years. So I started off with some very small pilot projects in my health board where I was working in acute medicine. So I actually started training as an anaesthetic training and then moved into GP. So this was quite a while ago. So I started up a small pilot project over several sites of offering free accessible period products, range of absorbency and types to my colleagues, and then measuring the usage, measuring the cost of what I was having to pay kind of on a weekly, monthly basis, and doing some small scale surveys of the need and the impact. And then I used that data to model upscaling to a larger extent, so over a whole health board or trust. So for people overseas, that's kind of like a small region where all the hospitals and general practice sites actually are located. And then what I also did was start to really lobby. So in my very novice approach, I approached my local MPs. I also approached other MPs in the UK who were seminal advocates for women or for menstrual health. I also approached the royal family, several members. It's the thickest letter I've ever got back. Their royal letters come in from Kensington Palace. So that's going to be framed in my house from now on in. And then I also did a lot of social media campaigning, but what I wanted to do was really share what I was doing, almost having it kind of open access. So sharing my learning as I went along so that anyone could take it forward and trying to encourage other people. And as this evolved, when the pandemic hit, I thought, staff are really, really going to be needing these products and also going to be needing other kind of toiletries and so forth, where they are in hospitals 24/7. So I managed to partially fund it myself, but also crowdfund. It's over, I think it was 65 boxes. I got this sent out to all ICUs, all emergency departments and acute medical facilities and COVID-19 field hospitals across Wales, and then some scattered around the UK. And then fast forward about a year or so after that, I also started creating an outreach program, which is basically an SOS box, so a period products box, which is fully replenished with all the period products. It's got the advertising materials. It's also got a USB stick with examples of evidence-based lobbying tools that anyone can use for their, and adapt for their local politicians, chief executives, and so forth, and some other things just to help people really kickstart their local programs. And I've sent boxes out across the UK and also to Malta too. So that's where I'm at. And you might think, well, that's a fair amount that you've done in a project. Shouldn't that really be the end? You know, you've really started to kind of percolate into people's consciousness and hopefully create the groundings for other people to take this forward. But I really, really wanted, my overall ambition has always been to see this essentially period products to be adopted nationally across all 4 nations within the UK, and then hopefully internationally by the health services. So the employers are actually providing these period products, which are freely accessible for any staff who menstruate on site. So that was my real ambition, to take that financial load off any colleagues or any individual sites, and really embed that with all the well-being evidence we know is so important for workforce sustainability, but also for patient safety. So I just thought my project, I would love to see what the HLA could help me shape it into. So I've always thought of the HLA as being a real hot house, as it were, for innovation, for thinking outside the box, for challenging in a very structured, evidence-based way, and also bringing so many different lenses in. So we learn about the philosophy of leadership and management. We learn about real kind of business techniques and tools, and we also learn about entrepreneurship and things like that as well. So I loved that kind of meshing into something that makes projects so much more. So I really wanted to see what I could do. So actually my project, how I started it out and what I actually proposed at the beginning, is continuing to evolve, because the more people I talk to in the HLA, the more work I do and find out a new avenue, or come across something in the reading materials that we're given, or at a scholar day, I add things in, I modify things and so forth. So this is what it's panning out at the moment, but it's actually still working, definitely in progress and evolving. So I'm creating a really robust evidence-based research piece, which is going to be a survey launching very soon for all UK health professionals who have periods or menstruate, so that we can really evidence for those who really need that kind of scientific evidence of the need for period products to be freely accessible, and why, you know, why there aren't other reasons why individual staff can manage this on their own, or should be able to control their periods, as some people have told me in the past. And then also what I've done, and I'm about to launch it very soon, is I've been busy crafting a website of my own. It's my first ever website I've ever created. I am really, really not the most technically finessed person. And so I've really benefited from other people coming in and helping me with that, and also learning from other scholars, and particularly from Melanin Medics. There's a really inspirational HLA project that I've really kind of shone a light on the way forward for me, and their website's fantastic. I'm also hoping through these efforts to actually create a network globally of local period parity champions for healthcare, because what I really hope is we can actually see the national adoption for healthcare staff across multiple countries, but that can also percolate out into our wider communities, so we can actually start to challenge stigma and cultural norms, which are different in every country in the world, but we can do that through our own advocacy. And that's really, I really want to empower other people, because there are so many fantastic leaders globally out there. And HLA just, it gives me the tools to be able to do that. It's just a fantastic community. And then I'm relaunching my social media campaign. I'm really benefiting from so many fantastic resources and teaching opportunities that HLA has given me that way. Then my final aim, which is probably going to be to the very end of my scholarship year, or maybe a little bit later on, is to organise a UK-wide stakeholder roundtable. So senior politicians, decision makers and NHS, and see whether we can get some agreements about a national accreditation for menstrual health. So a good employer watermark, as it were, that employers can work towards in healthcare, and also a national agreement to bring in free period products for staff. So I'm really sure that my timekeeping is really poor tonight. So I'm really sorry, Pedro. I've just got one more slide, but I just really wanted to acknowledge what the HLA has done for me and for my project. I've touched on some aspects before, but I just think there's so many lenses and so many aspects to the HLA that's just fantastic. And if you go to different opportunities, be it the Devon weekend, where my eyes were just open to so many different perspectives, and I was challenged in so many ways. You've got that diversity of resources that I've mentioned. So not just in terms of kind of the synchronous and asynchronous learning and the peer learning, the experiential learning, and so forth, but also the different kind of sectors that you're learning from as well. It's really, really practical. So there's so many practical tools. And I think Hallie talked about this. I do some work on some of the modules in the HLA scholarship, and then I go straight away and I change something in my project, or in another aspect of my leadership work, I change something, and then I can see the impact. And it's just absolutely fantastic. And the community is next to nothing. It's absolutely incredible. It's so warm, even if you meet virtually with people, and you just find that you have an affinity for people that you've never met before in your life in person, and you work so well together. And the mentorship program is absolutely fantastic too, and it really, really challenges you to think out the box that you and all your experiences might have created for yourself, and believe that you can be more than you probably ever thought that you could be. And yeah, definitely, it's all inspiration. It's complete immersion as well. So I wish you the best of luck with your applications. I'll wholeheartedly encourage you to take forward this opportunity. You really, really won't regret it at all.